Hey everyone, and welcome back. Ready for another deep dive?
Absolutely. Always ready to explore.
Well, today we're tackling a topic that's crucial for any nursing student heading into women's health: pregnancy.
Yes. The incredible journey of creating a new life. Talk about a transformation.
Seriously.
Yeah.
I mean, think about it. You're a nursing student, you're about to meet your first pregnant patient. What are the things you absolutely need to know to provide amazing care?
That's such a good question. There's so much to consider. Where do we even begin?
Well, we've got excerpts from some leading medical texts right here, ready to break down everything you need to know.
Perfect. Sounds like we're about to unlock some serious knowledge.
Oh, absolutely. And we'll be exploring everything from those telltale pregnancy trimesters
Right.
to those mysterious Braxton Hicks contractions.
Those Braxton Hicks. Always a fun one to explain.
I bet. But for now, why don't we just start with the basics? When we talk about pregnancy, we often say it lasts about 9 months, right? But is it really that simple?
It's actually a bit more complicated than that. It's not just a straightforward 9 months. It's more accurate to think of it as about 40 weeks.
Oh, interesting. So not quite a perfect 9 months then.
Nope, not quite. And to understand those 40 weeks better, we break them down into those 3 trimesters you mentioned.
Right, the trimesters, each one lasting roughly 13 weeks.
Exactly. It's like 3 acts in a play, with each trimester bringing new changes and development.
Okay, I like that analogy, 3 acts. So in Act 1, the first trimester, what's happening?
Well, that's all about setting the stage. The fertilized egg implants in the uterus, the placenta begins to form, and the baby's basic organs start developing. It's a period of rapid growth and change.
Wow, so much happening right from the start.
Absolutely. And speaking of growth, we can't forget about the star of the show, the uterus. It goes through some pretty remarkable changes throughout those 3 acts.
Oh, for sure. Talk about a makeover.
I know. Imagine this. In its non-pregnant state, the uterus is about the size of a pear.
A pear.
Oh.
Okay, I can picture that.
But by the end of pregnancy, it expands to, well, some say the size of a watermelon.
A watermelon, that's huge.
Right. And all thanks to this incredible hormone called estrogen. Estrogen basically tells those muscle cells in the uterus to enlarge. And as the baby grows, the uterus has to keep up, stretching all the way from the pelvis to the rib cage.
Oh, wow. I bet that journey comes with some interesting sensations.
You know it. And that brings us back to those Braxton Hicks contractions we mentioned earlier.
Oh, yeah, those practice contractions. So are they like mini labor contractions or something? What's the deal with those?
They're not quite mini labor contractions, but they definitely are a kind of preparation. Think of them as a warm-up for the main event.
So they're helping the uterus get ready for the real deal.
Exactly. They start in the first trimester, but they're usually irregular and painless. You might feel some tightening in your abdomen, but it's nothing too intense.
Interesting. So it's like the uterus is doing its exercises.
That's a great way to put it. It's getting those muscles toned and ready for labor.
Smart. Now, while the uterus is busy stretching and practicing, what's happening with the cervix?
The cervix. It's not just sitting on the sidelines, that's for sure. It undergoes some pretty remarkable changes too.
Oh, I bet. Fill us in.
Okay, so first off, it softens. This softening is due to increased blood flow and changes in the connective tissue, and we call it Goodell's sign.
Goodell sign. Okay, got it. Softening of the cervix. What else?
Then there's also a color change. The cervix actually takes on a bluish hue because of that increased blood flow we talked about.
Bluish, so it's like a mood ring for pregnancy. I love that.
That's a great way to remember it. And that color change, we call it Chadwick's sign.
Chadwick's sign. Okay, I'm adding that to my mental nursing notes.
Excellent. And while we're on the topic of the cervix, we have to talk about the mucus plug.
Oh, the mucus plug. That always sounds a bit mysterious to me. What is it exactly?
It's actually pretty simple. The mucus plug is basically this thick barrier that seals the opening of the cervix.
And what does it do?
Well, its main job is to protect the baby. Think of it as a shield against infection.
Ah, the ultimate bouncer. Keeps all the unwanted stuff out.
Exactly. It's there to create a safe and sterile environment for the developing baby.
Okay, so we've got the uterus expanding, the cervix softening and changing color, and the mucus plug standing guard. What else is going on in there?
Well, we can't forget about the hormones. They're the real puppet masters of pregnancy.
Oh, I know. Those hormones are running the show.
Yeah.
Estrogen and progesterone. They're like the dynamic duo of pregnancy, right?
Exactly. They're both crucial for making all these changes happen.
So tell me, what are estrogen and progesterone up to during pregnancy?
Well, estrogen is responsible for a lot of the changes we see, things like thickening the vaginal walls and increasing vaginal secretions.
Okay, and why are those changes important?
Well, those thicker vaginal walls and extra secretions, they're all about preparing the body for labor and delivery.
Ah, makes sense. Anything else estrogen's doing?
Actually, yeah. It even helps create a more acidic environment in the vagina, which you might think is a bad thing.
Right. Acidic sounds kind of harsh.
I know, right? But it's actually super important because that acidity helps inhibit the growth of harmful bacteria. So it's actually protecting the baby.
Wow, so the body is basically setting up all these defenses. That's incredible.
It really is. Now, let's talk about progesterone. It's a bit more of a behind-the-scenes player.
Okay, so what's progesterone's main gig?
Progesterone is all about maintaining the pregnancy. It's crucial for thickening the uterine lining, creating that nice comfy spot for the baby to implant.
Right. And what about contractions? Does progesterone play a role in that?
Definitely. Progesterone actually helps prevent contractions from happening too early.
So it's like the peacekeeper of the uterus.
Exactly. It's saying, not yet. It's not time for the baby to come out.
Amazing. So where does all this progesterone come from?
Well, at first it's produced by the ovaries, but then around week 7, something really cool happens.
What's that?
The placenta takes over. So the placenta actually starts producing progesterone and it becomes this hormone-making machine.
Wow, the placenta is like the ultimate multitasker, growing the baby and making hormones.
I know. It's pretty remarkable what the body can do.
It really is. Okay, now while we're on the topic of transformations, we can't forget about the breasts.
Ah, yes. The breasts are definitely not left out of the pregnancy party.
So what kind of changes can pregnant women expect to see?
Well, first off, they become larger. That's one of the most noticeable changes. And more tender, too.
Oh yeah, I've heard that breast tenderness can be one of the early signs of pregnancy.
It definitely can be. And then there's the areolas. They darken, and you might even see those veins become more prominent. It's all those hormones again, getting things ready for breastfeeding.
Right, so the breasts are basically getting prepped for milk production.
Exactly. It's all part of the amazing choreography of pregnancy.
Okay, so we've covered a lot of ground already. We've talked about the uterus, the cervix, hormones, and even the breasts. But I want to zoom out a little and talk about the big picture, the cardiovascular system. What kind of impact does pregnancy have on the heart and blood flow?
Oh, that's a great question. Pregnancy is a major cardiovascular workout for the body.
In what way?
Well, for one thing, blood volume increases dramatically during pregnancy. We're talking almost 50% more blood.
50% more. That's a lot of extra blood. Why is that necessary?
It's all about supporting both the baby and the mother. That extra blood is crucial for delivering oxygen and nutrients to the baby and also for supporting the mom's body as it works harder.
So the heart has to work harder too.
Absolutely. Cardiac output increases significantly, meaning the heart is pumping more blood per minute. It's like the heart is going into overdrive.
Wow, the heart is a true champion. But with all that extra blood pumping around, are there any potential downsides?
There can be, yeah. One common issue is swelling, especially in the legs and feet. That's because the extra fluid can sometimes pool in the lower extremities.
Oh, that makes sense. Anything else?
Yeah, sometimes those swollen veins can become varicose veins. They're not usually dangerous, but they can be uncomfortable. And then there's supine hypertensive syndrome.
Supine hypotensive syndrome. That sounds serious.
It can be if it's not addressed. It happens when the pregnant uterus compresses a major vein when the mother is lying flat on her back.
So it's all about positioning.
Exactly. This compression can reduce blood flow back to the heart, leading to a drop in blood pressure. So it's really important for nurses to be aware of this and position pregnant patients on their side, especially in later trimesters.
So important. Okay, so we've covered the heart and blood flow. What about the digestive system? How does all this impact digestion?
Well, pregnancy can definitely throw the digestive system for a loop. You know those hormonal surges we talked about earlier? Those can have a big impact on digestion.
Right. The hormones are calling the shots yet again.
Exactly. And one of the most common digestive complaints during pregnancy is, of course, morning sickness.
Ah, yes. Morning sickness, a classic.
It's often caused by that surge in HCG, the pregnancy hormone.
So it's those hormones again.
Yep. But morning sickness is just the beginning.
Oh, there's more.
Unfortunately, yes. Pregnancy can also bring on constipation, heartburn, and even bleeding gums.
Wow, it sounds like the digestive system goes through a lot during pregnancy.
It really does. The growing uterus can put pressure on the stomach and intestines, slowing things down and leading to constipation.
That makes sense. What about heartburn?
Heartburn often happens because the valve between the esophagus and the stomach relaxes,
Hmm.
allowing stomach acid to back up. And the bleeding gums, that's just those increased blood flow and hormones at work again.
Wow, so it's a whole body experience. The digestive system definitely gets a workout during pregnancy.
Absolutely. It's all part of the amazing journey.
Okay, so we've covered a lot of internal changes. Now, what about the external stuff? What about all those skin changes that happen during pregnancy?
Oh, yeah. The skin definitely goes through some interesting transformations. It's all part of the show.
So what kind of changes can pregnant women expect to see on their skin?
Well, one of the most common ones is linea nigra.
Linea nigra, what is that exactly?
It's that dark line that appears down the middle of the belly. It's thought to be caused by hormonal changes that increase melanin production.
So it's like a natural tattoo.
Exactly. It usually fades after pregnancy, but it's definitely a noticeable change.
What else? What about those dark patches on the face?
Oh, you mean cloasma?
Yes, cloasma.
Ah,
I've heard it called the mask of pregnancy.
that's right. It's that darkening of the skin on the face, usually around the cheeks, forehead, and nose. Again, it's those pregnancy hormones stimulating melanin production.
Okay, so linea nigra and cloasma, both caused by increased melanin. Anything else?
Oh, don't forget stretch marks.
Ah, yes. Stretch marks. Those are a classic.
They're super common during pregnancy. It's just the skin stretching to accommodate that growing belly.
Right, so it's like the skin is trying to keep up with the changes.
Exactly. And while stretch marks can be frustrating for some women, they're really nothing to be ashamed of. It's just a natural part of the process.
Absolutely. They're badges of honor. Proof that your body did something amazing.
I love that perspective.
Okay, so we've covered a lot of ground today. We've talked about all these incredible changes that happen during pregnancy, from those early hormonal shifts to the stretching uterus and the skin transformations. But before we wrap up, we have to talk about the signs of pregnancy. You know, those clues that tell us a woman is actually pregnant.
Yes, it's like detective work, figuring out those early signs.
Exactly. So how do we go about determining if a woman is pregnant?
Well, we look for certain signs and symptoms that are characteristic of pregnancy, and we can group these signs into three categories: presumptive, probable, and positive.
Okay, so 3 categories of signs. Tell me more about those.
All right, so presumptive signs are those subjective changes that a woman might notice. Things like a missed period, breast tenderness, and fatigue.
So those are kind of hints, but
Yeah.
not guarantees.
Exactly. They could be caused by other things besides pregnancy. Then we have probable signs. These are more objective findings that a healthcare provider can observe.
Give me some examples of probable signs.
Sure. A positive pregnancy test is a big one. And then there are changes in the size and shape of the uterus that a provider can feel during an exam.
Okay, so we've got those hints from the presumptive signs and then the more objective evidence from the probable signs. But what about the definite confirmation?
That's where the positive signs come in. These are the signs that definitively confirm pregnancy.
Okay, I'm all ears. What are those undeniable signs?
Well, there are three main ones. First, hearing the fetal heartbeat. That's a pretty clear sign that there's a baby in there.
Absolutely.
Well, second, feeling the baby move. Once those little kicks and flutters start, there's no doubt about it.
So exciting. And the third sign?
Seeing the fetus on an ultrasound, that's the visual confirmation that everyone's looking for.
Amazing. So those are the 3 positive signs of pregnancy.
Exactly. Hearing the heartbeat, feeling the movement, and seeing the fetus on ultrasound, those are the gold standard.
So there you have it, future nurses. We've covered a ton of ground today, from trimesters to Braxton Hicks contractions, from hormonal havoc to those amazing skin transformations. It's pretty remarkable what the female body can do, wouldn't you say?
It's absolutely incredible. The whole process of pregnancy and childbirth is just awe-inspiring.
I agree. And for all our nursing students out there, I want you to think about this. Knowing all of these changes that happen during pregnancy, how can you best support and educate your patients? They're going through a lot, both physically and emotionally. Remember, providing excellent care isn't just about knowing the facts. It's about connecting with your patients, understanding their concerns, and empowering them with knowledge.
That's such an important point. Pregnancy can be a time of great joy and excitement, but it can also be a time of anxiety and uncertainty. As nurses, we have the privilege of being there for our patients every step of the way, providing support, education, and compassion. So keep learning, keep asking questions, and keep that passion for women's health burning bright.
Couldn't have said it better myself. All right, everyone, that's a wrap for another deep dive. Thanks for joining us, and we'll catch you next time.
See you then.